Hello friends, myself Dr. Priyank Salecha, consultant urologist and andrologist, will be briefing you on a very common topic, renal calculi. So what is renal calculi? It is microcalcifications, nephrolithiasis in other words, which are formed within the kidney itself. Very common question asked in today's clinics is why renal stones are formed. So one of the most common factor leading to renal stone is dehydration, means taking less amount of water. Second is infection. Third depends upon the type of food what we eat, like protein rich food, oxalate rich food, calcium rich food. Fourth, any anomalies within the urinary tract itself. Fifth, drug induced. Sixth, maybe idiopathic, means a forgotten stent, etc. etc. So these are the basic causes why a stone is been formed within the kidney. What are the general symptoms when a patient is having renal stone? Patient will have colicky pain radiating from back towards downward, associated with nausea, vomiting. It may also be associated with fever, burning micturition, blood in the urine, and in severe form they may come up with the term called urosepsis, where they end up with high grade fever and hypotension, means low blood pressure. Signs, how we evaluate the patient with renal stone. When a patient comes up in the OPD with pain, fever, radiating pain, with burning micturition, blood in the urine, the first three investigations which we do is simple X-ray KUB, a ultrasonography of abdomen, a blood report sample called complete blood picture, and a complete urine examination. Depending upon that, we may even what we tell order for CT scan like KUB or a whole abdomen. Once the patient has been diagnosed having a renal stone, we categorize the patient whether they require a medical treatment or a surgical treatment. Medical treatment is basically advised in patients having stones less than 5 mm and are not associated with severe factors like fever, excessive vomiting, pain, or blood in the urine. Surgical treatment is basically required for stones which are more than 7 mm in size or associated with high grade fever, pyelonephritis, severe pain, tenderness, blood in the urine, and excess amount of vomiting leading to dehydration. So in medical management, we ask patients to drink lot of water, means every 2 hourly 1 glass of water around 250 ml per 2 hours. Also we give them antibiotics, we give some diuretics and some medications to push the stone out in form of alpha blockers. In surgery nowadays, we don't make any big cuts or stitches or holes. In this era of laser treatment, we can normally treat most of the stones up to 2 cm with laser treatment in form of URS or RARS. Last treatment for bigger stones which are formed within the kidney go up with a procedure called PCNL. We make a very small hole on the back and with laser we completely powder the stone and come out. So this was a brief note on renal stones. Please inquire if you have any. Thank you.